A 35-year-old male presenting with persistent low back pain. Onset was about 6 months ago, and he was a little bit unclear about what caused it. And he's coming for treatment recently. He's had 3 treatments. This is with a practitioner that he's seen, and the practitioner was asking me if I could add anything, if I could help with this, because it wasn't getting any better. And so we dug into the history a little bit more, and I wanted to explain to you what happened and why we got the result and the breakthrough with this, because I think it may help you with some of your low back pain cases. Because the thing with low back pain is that, of course, there can be so many different causes there and so much different intricacies in terms of that low back and what's going on there. And so obviously that's where our focus is going to be. We can spend a lot of time examining that area, a lot of time treating that area, but unless we look further, then often we can find that we miss little things that are actually the root cause of what's going on with this low back pain. And that's what the case was in this particular patient. Because when I dug into the history a little bit more, there was an incident a couple of weeks before that, the pain that came on, and this is where it's difficult taking history, because often patients won't tell you these things, where the patient had had a fall, but because they hadn't had a fall in their low back, they didn't think it was particularly relevant. What happened was they'd had a stumble on the stairs, and they reached out with their arm and they grabbed hold of a railing there to stop themselves falling, and so they'd had a yank on that arm. Now, they did have some shoulder pain at that time, but that had resolved, and because this was now 6 months later when they came for treatment, they didn't really particularly think it was of interest. Now, what happened was, when I discussed this with the practitioner, they went back and they looked again at that hole through the shoulder area there. And when they did, they found that this was the issue, and this was the key to unlocking the low back. Because what was happening was they were treating the low back, and they were finding that the sacrum and the innominate were not operating in terms of where they should be, and they would treat them and it would resolve, but then it would come straight back again. And the reason being is because of the lat muscle. If we have a look, cut here to this shot here of the lat muscle, and we can see that this big lat muscle is coming down and is inserting into the sacrum. Now, if I run this shot on in terms of the motion of the lat muscles and what it does, what we'll see here is that big stretch on that lat muscle, and that's obviously coming down all the way down into the sacrum. And so if we imagine a force where we get this yank on this arm, then it's going to cause this contraction through this pull initially, but then a contraction through that lat muscle in order to try and counteract the fact that they were getting this yank through this muscle and then it doesn't want to rip. So there's going to be a response there. And often we'll see that. You'll see us in the neck, you'll see if a neck is pushed to one side, you get an initial stretch of the muscle and a contraction to prevent further injury. And so if we run this on back into this normal position, we'll look there in terms of that coming up into the extended position, and then when we bring it back down into that standard position, then what we can see here is that muscle is going to be contracted. Now, if that muscle contracts, what's it going to do? It's going to drag that sacrum upwards on this side, and so we're going to get this issue with the sacrum not operating properly, not being able to function properly in relationship to the L5, but also in relation to the innominate. Now, there's other aspects we could talk about the sacrum there in terms of its function, the dura all the way up the dural tube, strong dural attachments at S2, influence on C2, influence on that whole spine. But what we can say for certain is that there's going to be a strong influence through into this low back. And so when the practitioner looked at that and they think, yeah, there is something going on still with that shoulder, and they addressed the lat muscles, then they were able then, with their other treatment, to stabilize that sacrum in terms of making a change and that change staying and not reverting back. And they got really good results for the person, and the person resolved quite quickly. Now, if we move on to terms of what treatment we want to do, in terms of the lat muscle, well, you can put your hands on this big bulk of the lat muscle here, but it's actually quite a thin muscle in this area, and it's actually quite hard to treat in that respect. What you can do is put your hand, patient is prone, put your hands on flat, laid out, and then just try to get a contact and work in a kind of a fascial way, in a more of a functional way, to try to get a little bit of release through that latissimus muscle. But often what I find works better, or in conjunction, but certainly gets you the change, is you come around in here and you actually start to try and get up here into this insertion of that lat muscle. And if we drag that up into that position, you can find that you can work in that position. You can extend the arm out, and then you can work on that actual attachment there into the humerus on the lat muscle and see if you can get some change. Often put in a shoulder or a limb into the position where it experienced the injury is a good way to work with that. And you can bring that up, work that in a functional manner, work that in a way where you're trying to get ease. So that's one way of working with that lat muscle. The other way is to let it come down into that actual anatomical position. I'll let this come back down here. And it's not quite an anatomical, but you know what I mean here. And then what we can do is you can bring your fingers around and again work on that attachment, but as we move that arm in this arc from in that little arc there, just in that little arc from that anatomical up again, just swinging it back and forth, back and forth, back and forth. So the one hand is moving a little bit of a long lever, and then that other hand is on the actual attachment of the lat muscle, and you get some sort of normalization through that area, addressing some of the shock and the kind of holding in that area, because it's been a long time that's been in that position, in that 6 months in that position. Now, in addition to that, if you've had the lat muscle in that contracted state, then you're going to get some internal rotation here, the shoulder joint, and you're likely to find that there's pec muscle here, pec minor, pec major, they're going to be contracted as well. So some work into those areas certainly is going to help trying to normalize the function through that shoulder. Once you've done that, you then may find that you need to come back down and do some of that work again in the sacrum. If you started in the sacrum and it wasn't taking that, that you worked there, they came back, it was same again, then that doesn't mean that work you were doing wasn't good. It just means that this function through this shoulder needed to be addressed properly first. That needed to be normalized, and then you can come back down, work on the sacrum, work on those areas in terms of looking at that function between the sacrum and the innominate. We'll pull off the muscles here, and making sure that you've got good function in this area, so that the innominate and the sacrum through that SI joint, that's working nicely, so that when the person moves, you're able to get good function between the sacrum and the innominate, and between the L5, and in terms of the coordination as well, so between the sacrum here, pelvic floor sacrum, and the diaphragm up through here. So the two areas are working nicely together, and in terms of the curves of the back, they are not going to be able to do that unless that lat muscle has been freed up. You've looked at the sacrum and innominate, and it has free motion. Once you've done that, there may be a case of a couple of weeks where that patient needs to, they've been 6 months in this kind of thing, in that not working properly, a couple of weeks of that kind of coming back to that proper state, and so you can give them a few exercises through stretches to help with that, or simply that patient is just told to, hey, you now got better motion there, but don't go out and do any crazy stuff and send it back into into that state of freezing up, of feeling under strain. Because what happens if someone has been 6 months and not been able to function, and suddenly they can, because you get a great release through that lat muscle, through that low back, then they're going to go, right, well, I haven't done the lawns for 6 months, I haven't done this, I haven't done that, I haven't been out surfing, and they're going to charge back into it. So it's really important to let them say, hey, yes, you got that function back, but remind them how they have been. You don't want to slip back. So yes, start moving, start getting going, but don't go crazy in the gym, don't go crazy in that kind of thing. We're going to need to work with this for the next couple of weeks until you're back to full function, and then you can go for it. So I hope that little case has been of use to you. There's two really important things here. One is that use of that lat muscle and that shoulder and the link down into the low back. But the second one is just more general, in case of, we are wanting to work with the whole body. So regardless of what they're complaining of, sacrum, neck, headache, wrist pain, then yes, we obviously need to pay attention to that area, but we also need to pay attention to the whole body and do a screen of things. And if we're not getting the results we want by working locally, then we need to look at that a little bit wider and be that little bit holistic, to use the word that everybody likes to use. Now, if you like this video, do check out the two playlists. One is on treating adults, one is on treating babies. Of course, also, if you subscribe to the channel, just click on the Kindred Owl to do that, then you won't miss any of the new videos that I post up here regularly on the channel. Thanks for watching.